Hello everyone, this is Nurse B with Buzzing with the Bee. Today's vlog is about the COVID-19 vaccine. Before I get started, I want to direct your attention to the like, share, subscribe button hovering over me in the corner. Please press this button if you like the video or want to follow me. Now, the news media has been abuzz about the COVID-19 vaccine for the last week. I want to give you some information about the vaccine that will help you to decide whether or not to take the vaccine. The purpose of this vlog is to discuss how people achieve immunity to diseases, how the COVID-19 vaccine is made, how the COVID-19 vaccine works, the side effects of the vaccine, and who will get it first. Now, to achieve immunity to a disease, most people get it naturally through an infection with the disease, but we really don't want that to happen. You can achieve immunity through an artificial means, and that's through immunization. So that is what we're going to talk about this time. The immunization with the COVID-19 vaccine involves breakthrough technology, use of the messenger RNA. Scientists were able to identify the genetic code of the coronavirus and made a synthetic copy of the virus to be used. The code of the virus contains both DNA and RNA strands. Now, what they found was the RNA strand contains a function that's called a messenger RNA, and that function is attached to a protein. So what they did is that they created a spike glycoprotein to inject into your body as the vaccine. So what will happen is that once this vaccine is injected into your body, your immune system will react to that foreign substance. Once the vaccine is injected into your body, the messenger RNA will tell that synthetic spike protein to open up and release the enclosed protein. Your immune system will recognize this protein as a foreign agent and will attack it to stop the protein reproduction or replication. Now, let's talk about the players in this immunity game. The players consist of the enemy team and the defensive team. For the purposes of this vlog, the enemy team is the foreign protein that is in the vaccine. The defensive team consists of white blood cells. White blood cells that will be used for this defense are your neutrophils and your monocytes or macrophages. Other defensive team members include your T cells and your B cells. Now, the first play of the game begins with the injection of the vaccine into your body. Then the defensive team will come out. The defensive team will send out a first line will be your white blood cells. These white blood cells will attempt to eat that protein and destroy it. Portions of the protein will be on the surface of the white blood cell. When that happens, the white blood cells will send a signal to your helper T cells. The helper T cells will become active and they will join in the fight as natural killer T cells to try to kill that protein molecule. The other thing they will do is that they will send a signal to your B cells that are on the sideline. These B cells are just sitting there waiting for a signal from the helper T cells. Once they receive that signal, they will release antibodies. These antibodies will do two things. One, some of the antibodies will be attack antibodies, and there will be another group of antibodies called memory antibodies. And these memory antibodies will stay in your body for a certain length of time. And if they detect a future infection with the coronavirus, they will actually attack that virus right away so that you will not get an infection. Now that we know how the vaccine works, we need to talk about who will get the vaccine first. Well, the vaccine was approved for anyone aged 16 years of age or older. The people that will get the vaccine first are your healthcare workers and residents in long-term care facilities. Now, within the healthcare workers are 330,000 females. At any time, these women can be pregnant and lactating. These women need to consult with their OBGYN first before taking the vaccine. The reason for this is because pregnant women were not included in the clinical trials, so therefore we do not know the effect of the vaccine on the unborn fetus. Also, the FDA wanted to give pregnant women the opportunity to take the vaccine because many pregnant women who contracted the COVID-19 virus and became infected had a more difficult time with the infection than non-pregnant women, and some of them did die. Now, over in the long-term care facility, the residents are usually elderly people, and many times elderly people have underlying health problems. These underlying health problems contributed to the morbidity of this group of people with the coronavirus. More older people died from the virus than younger people. Also, because these people are living in a residential facility, they are around numerous people, and those people can spread the virus rapidly, and we need to protect them. Also, the healthcare workers in the nursing home need to take the vaccine. So the vaccine consists of 2 injections taken 3 weeks apart. This vaccine, like all vaccines, have side effects, and all drugs. Minor side effects of the vaccine include fatigue, headache, muscle ache, joint pain, and redness and tenderness at the injection site. Other more serious side effects or adverse effects include temporary facial numbness, tingling, and paralysis that may last a few days, enlarged lymph nodes in your neck, arms, or groin, and severe allergic reaction. If you are a person who has a history of allergies, you need to proceed with caution when taking this vaccine. Talk to your doctor first. If you decide that you want to take the vaccine, you need to take it in a facility that has the capability of emergency medical management in case you have an anaphylactic reaction. If you have an anaphylactic reaction, you will experience symptoms like constricted airway or trouble breathing, swelling of the throat, increased heart rate, a sudden drop in your blood pressure, and feeling lightheadedness or dizziness. So make sure, if you have a history of allergies, that you take this vaccine in a facility that can monitor you before, during, and after treatment. I hope this video has been helpful in helping you to make a decision of whether or not to take the vaccine. I know that some people are leery of or afraid to take the vaccine. I was one of those persons who was leery about taking that vaccine until I found out how it's made. Now that I know it is not made from a live virus, I feel more comfortable taking the vaccine because it's made with a synthetic code. Now, let me say this, that if I was pregnant, I don't know if I would take the vaccine. So these are some decisions that people will have to make for themselves and in conjunction with their significant other or their doctor. I will continue to make some vlogs about the vaccine to keep you abreast of what's going on with it. So, with that being said, I want to thank you for viewing this vaccine. I hope that you will follow me by pressing the subscribe button. I have enjoyed talking to you on this episode of Buzzing with the Bee. If you want to follow me, you can go to my webpage, nurse-b.com. Remember, this vlog is for healthy living purposes only. It does not supersede the advice of your physician. So please, before taking the vaccine and you have questions, please talk to your doctor first. Thank you.